Welcome, dear viewers, to our natural medicine format. Today, I would like to show you something very special, something that has totally touched my heart, fascinated me. I am thrilled, and when I'm enthusiastic, I'm also full of euphoria. And I would like to explain why that is the case today. It's all about an exercise device, an exercise machine that allows us to take 10,000 steps at home in a very short space of time. And we all know that exercise is healthy. And my guests, who I will introduce to you after the intro, will show you how it works. See you in a moment. Yes, and here we are again. And now it's my turn to introduce my guests. I have invited a patient here, Silvia Kirschner. A very warm welcome, dear Silvia.
Hello.
You've used it, and you wanted to share your experiences today. Thank you.
That's right.
For your courage. But we'll do that later. Then I have Roswitha Lülf here. You're a sports therapist.
That's right.
You're very welcome. And you brought your husband with you, who is also a sports therapist, a physiotherapist, and alternative practitioner.
That's right.
Very nice. So welcome, everyone here in the group. And first I'll start with you. You have a very impressive story to tell. You were a patient who suffered from osteoarthritis.
That's right, yes. So that was last year in September. I woke up in the morning and thought, what's wrong with my right index finger? It hurt, like I'd hit it on a piece of wood. It was very painful, and well, I forgot about it at some point. And then the pain came back again and again and again. And then I rubbed it with Voltaren, anti-inflammatory ointment. Unfortunately, nothing changed, nothing improved. At some point, after 4 weeks, I had to go to the doctor and raise the issue. And the doctor said, yes, it's osteoarthritis. Unfortunately, there's nothing I can do. I should put a wrap around it and rub this ointment on it. And she couldn't help me with anything else. And then I thought, I've been doing this for 4 weeks now. What's it going to change? Then I remembered my Siwave in the living room. And I just got it out and put my hands on it for 3 minutes, other side for 3 minutes, and applied it 3 times in a row. And my osteoarthritis is gone. I no longer feel anything at all. There was always tension in my finger, but it's gone. I can move it normally again, so it's perfect again.
What irritates me a little is that, in my understanding, osteoarthritis is also a story that has a connection with nutrition. But you haven't changed anything.
I haven't changed anything at all. I went on Siwave 3 times in a row, and then everything returned to normal.
Is the pain gone?
Yes, the pain is gone. I would like to continue with you. How can you explain the fact that you can now only do exercise therapy? Of course, the blood circulation is probably better. The detoxification is better.
Yes, the metabolism will be stimulated again if there is a focus of inflammation somewhere. Then it also breaks down more quickly. Exercise does this too, of course.
So that's not the solution for all osteoarthritis patients. Just doing exercise without also doing something about your diet. How do you see it?
Let me be very brief. I really am a specialist when it comes to osteoarthritis. I'd like to say one thing. Osteoarthritis hasn't gone away.
I apologize for this interruption, but please subscribe to our YouTube channel because it helps us to spread the word about this show via YouTube. Thank you very much. Have fun. See you later. Goodbye to each other.
No, osteoarthritis is nothing other than joint wear and tear, and we can grow quite old with it. But osteoarthritis must not become inflamed due to overloading, for example. It can't do that, then it hurts. And what you did intuitively was right. Movement is life. Movement gets in there, the metabolism is stimulated, toxins are broken down, metabolism is stimulated, inflammations are broken down. That helped you, quite simply.
Okay.
Does she still have any risks now? You say she's never got rid of osteoarthritis. It's always there, but it doesn't hurt. That means that if she continues to do it regularly, it will stay that way.
That's right. But you can't just assume the diagnosis of osteoarthritis. We all have it, lots of people have it, osteoarthritis, and we can grow quite old with it without it hurting. It's only when the osteoarthritis is overloaded that we have a problem. And what you then have to do, of course, is not just look at the hand or the fingers, but the knees, where we also tend to have it, or the hips. Then we stabilize, then we strengthen the supporting muscles of the knees. We stabilize with the Siwave through this sinus wave. And once we have achieved this, we not only have an improved metabolism, we have also built up excellent muscles around it, and then you can go through life well, even with osteoarthritis. Unfortunately, the wear and tear, the cartilage that is worn out, will remain.
Wow, you're talking really well.
Yes, thank you.
Wow, you work with athletes?
Not with athletes, with patients. We have a large practice in Pforzheim, and when they come in and have a slip disc or something like that, they are of course treated with physiotherapy, and then they often come to me for sports therapy, where we then simply continue to treat them with the Siwave.
What is possible for herniated discs without surgery? With this approach?
Yes, of course, we also have to stabilize in any case. Depending on where the herniated disc is at the time, we can, of course, use the device to loosen up a little on the one hand, because muscles are often hardened, and so on. On the other hand, of course, we can also slowly build up the muscles. And since people or patients are also in pain, this is, of course, ideal before they have to work so much with energy. They stand on it, and we can then make a difference right from the first therapy session.
You have a rehabilitation practice.
That's right. We also call ourselves Roswitha Lülf. Of course, the structure, if I may interject very briefly and now see many spectators and think, oh, great slip disc, let's go to Siwave. Let's go to Siwave. Of course, you have to wait a bit at the beginning. What kind of herniated disc do I have? Is it acute? Then I'll leave it alone for the time being. Acute conditions, that's not the way to go. But you can do it later to build up your muscles. Excellent training for the support muscles of the spine. We reach with those oscillations the smallest muscles in the spinal column, which stabilize segmentally. We don't just reach the large muscles that are straightening, but really small segmental muscles. And that is also the result afterwards, what is required after the training. Much better stability, much better mobility in the area of the herniated disc.
But if we look at the device in general, you just stand on it and let it shake you. It is actually a sine wave. It's specifically a harmonic frequency. What does it actually do to me? Does it train all my muscles? Are all the blood planes being forced as if by blood? What is going on?
Well, this sine wave is actually at the top of the list. This sine wave is based on 3 pillars. The first pillar would be to give a neural stimulus to the muscles via proprioception, let's call it. This actually strengthens these muscles, as you just rightly said, all over the body. I'd say when I stand on it with my feet, not so much my arms. But apart from that, it actually strengthens muscle groups that you can't move at all, consciously and very little. That's the pelvic muscles. Tighten this pelvic muscle. You might ask how. The Siwave can actually do that.
What's their name? A urologist was just there and told me that many men have pelvic floor problems, with all the consequences that men have from a certain age onwards, men from a certain age. And the solution would be pelvic floor training.
That's right.
That's it.
That's it.
So gentlemen over 50 with certain problems that we don't want to tackle right now could do pelvic floor training here. Saunrenner?
That's right.
Just standing on it, or somehow tensing a muscle.
We've already done everything from sitting on it.
Oh.
We also have some patients who come in and do that.
So if you actually do pelvic floor exercises, you can stand on it, you can sit on it. Of course, it's very intense when you're sitting on it. But then you also put a little padding underneath. Then it's also more comfortable to pick up. But you really do get, if I may say so, incontinence, old age incontinence. We can manage that very well. Just with training sessions with the Siwave.
You're saying incontinence now, because that's not even on your radar. But that's a huge issue also.
Oh yes, it's a big issue.
For a lot of people, after operations too, isn't it?
Yes, prostate operations. But then of course you have to differentiate again. We don't want to have a miracle cure, but we do have a device that stimulates the entire human organism in a really excellent way. Of course, if I have a nerve transection, for example, due to a prostate operation, for example, and the nerve has been injured, I have some difficulties that I can get there and get the incontinence under control straight away. I have to get the nerve under control first. The Siwave does that too, but it also sends stimuli to the nerves. And this means that nerves receive stimuli, which can then recover. But that takes time, we know that. Nerve damage takes time, you need time. But I just wanted to say, the difference there is an injury, of course. I may have incontinence as a result, but if I have age-related incontinence, I can manage it very, very well with the Siwave. That's been our experience.
What other symptoms do you treat with this device?
It would really go beyond the scope of this program if I were to list all the symptoms. But I would just like to go into the orthopedics. We've just been talking about the back. Many people suffer orthopedically, intervertebral discs, these stories, all the back problems that we have to treat with the Siwave. Wonderful story.
So people actually treat themselves then?
So to speak.
If I had something like this and back problems, would I sit on it or stand on it?
Exactly, you stand on it, and then you have your frequencies that you set. You have the foot position you need on the Siwave, and then you actually have several options. The device is designed for exercises. You don't just stand on it. You can use aids, whether it's an elastic band, whether it's a wobble bar, afterwards. There are so many ways to multiply the whole thing. The next thing would be neurology, to simply take something out of it. That would be the Parkinson's patient, for example. There are some nice studies, Dr. Zeiser has done them, where excellent results came out. And then there's gerontotherapy, or therapy for the elderly, as they say. For old people, do I have to be ill to train with the device? No. I can also do something prophylactically. That's what we have with older people. Fall prevention is a huge issue. My wife, Roswitha, also works very intensively with older people.
What does it look like with these older people? If they're already a bit stiff and immobile, and you work with them, what happens?
Yes, we move first. I then give senior courses, and at the very end, they are placed on the Siwave. And they themselves really have the feeling when they get down there that they have more strength, that they have more stability, but it's the regularity that really makes the difference. So that's the case in all areas, the regularity of training with the device.
What happens if someone really 10 minutes a day on this machine for 2 months and was relatively sluggish at the beginning? Where are they after 2 months?
Well, they can definitely walk better. The whole coordination thing also changes. You can tell that they're more upright, the people, no longer so crouched. That's true, but you can already see a big result after 2 months.
A good result.
Rollator issue. Can you get rid of it?
Yes, let me put it this way. Maybe it still has to be used, but they walk quite differently, of course. And they can already move around the apartment on their own. So we've already had great success there. Or even people who came in a wheelchair, who simply had really severe rheumatic diseases, where we had real success. All they could was stand. After a short time, they were even able to take steps on their own. 1 or 2 steps, and then it was increased. Of course, they then set up this device at home and were able to train with it every day. That's always the thing, the regularity.
What I've noticed about myself now, is that my sense of balance has improved considerably since I started using Siwave. I can jump down the stairs again like I did when I was younger. I no longer have to hold on to the banister or anything. I can do it perfectly.
I'm glad you just said that. I've been doing strength training again for 2 or 3 months now. I've been training my abs, legs, and booty with my wife. I'm the only man, 30 women, never mind. But what we also learn is a lot of balance. I'm 55 years old. What I've given up is unbelievable. And after 2 months, I really went from 0 to 100. But I hadn't even thought about the device. You train your sense of balance with it. It's so important. It takes away the risk of falling.
Exactly.
It really goes hand in hand. And it was the same with you. You told me earlier, she was always tripping. Little things, really falling down, could have hurt herself badly. Then she went to the Siwave, trained for a while, and suddenly she was walking without stumbling.
Is this because of the muscles, or are these generally less weakness due to blood and more oxygen in the blood? What is the reason is this due to?
First of all, the fall, the stumble, as such, certainly has something to do with the fact that her muscles and stability were not quite right. There was a mistake somewhere. And the Siwave doesn't just train individual muscles. We train entire muscle chains with the Siwave. This means that when you're running, you don't just have the calf and the thigh which you move. There are many different muscle chains that you are working. And when a muscle chain is used properly, then it also runs better. This gives it a completely different stability, a completely different security. And that brings us back to the sports area, where I said earlier, what else is the machine for? You don't have to be ill to train on it. We have athletes who try to jump higher with the Siwave. So now they are not building up a huge muscle with the Siwave, but they are shortening the reaction time of the individual muscles when jumping. You can perhaps also imagine that if the muscle now only starts from the arm when I raise my hand and it goes slowly, then of course naturally don't have the power. However, if this time is shortened by these neuronal stimuli, by the Siwave on these muscles, he jumps higher without having built up muscles. Perhaps you could also say that the muscle technique has improved.
Do you know how I came across the device?
Say.
A reigning world boxing champion called me, Senat Gashi, and said, "Hey Alexander, you have to see this."
Do you see it?
Yes, great.
Because they work in professional boxing, reactions, and this and that. Yes, I'll have to take a look at that. And now I actually know the previous model.
Okay.
Yes, it's the same manufacturer. That was quite fascinating. That closes another circle for me. So I'm thrilled. What I also heard today, but probably less likely to come to you, but the device apparently also helps a lot with cellulite problems and varicose veins.
We have that too. So included, we get these requests very frequently.
And what are the results? Does it actually work?
The regularity, so you have to keep at it quite often. That's our experience.
I simply see that this is a big problem within society. We eat more and more junk, and the waste has to be deposited somewhere. It goes into the connective tissue. Zeolite is the result. Varicose veins are also a problem. If there were suddenly a thrombosis and so on, that could be prevented by regular measures to promote blood circulation.
Yes, definitely.
You also build up your muscles. The blood vessels all benefit from that, whether it's the arteries, the veins, or the lymph vessels. They simply benefit from muscle tone. And if it's better is better, and you're also doing some exercise, you're doing everything right.
Lymph or lymph congestion. I then have water in my legs very quickly.
That's right.
And that's also painful. People can't sleep because the water simply hurts over time. Can you get that out? Do I have to somehow hold my feet up for half an hour, lie on it?
So really the fact that the water is now, let's say, released, well, there's damage. There are also different diseases. But let me put it this way. You are definitely improving this edema. You prevent erysipelas. Erysipelas is a bacterial inflammation. And you are regulating the metabolism in the legs. And that's important, of course. If it's set up, then a bacterial inflammation won't occur in the first place. When you stand on it and the muscles contract, release, and contract again. It's like a muscular pump, which you can also use with your feet. You're actually exercising the water out. The fact that it's gone afterwards is another matter entirely. But you will definitely have a positive effect on your edema. The extent will definitely improve.
What I hear again and again is that when people have an operation and have to lie down for a long time due to the healing process, there is also a lot of muscle loss. What does it look like when you're in this convulsive phase and you're already able to sit or stand on a device like this? Do I then also lose muscle mass, or can I stop it?
You mean when someone has to lie down for longer?
Yes, exactly.
It's like a paraplegic patient who can't stand, who can't walk. The patient who is bedridden can perhaps a certain time not move properly at all. Then, there are the metabolic diseases that we have as a result due to lack of exercise. Then there are adhesions, which we also have a lot of with fascia. That's the muscle skin, to put it simply. The muscle skin around the muscles, and it can stick together. This is a very big issue in nursing homes. They lie there. The patients can't get out on their own.
Sticks together more and more.
Yes, a lot. And then these fasciae shorten, and we call them fibrosis, which means they harden. And you actually, I'm going to start with the knee. You can't actively stretch the knee. Not the patient or the person. And even as a therapist, you can't get it stretched. And when it gets that far, it will also be difficult to solve with the Siwave. And that's why the Siwave is so important, even in nursing homes, to keep the fasciae supple, to prevent fibrosis of the fascia from occurring in the first place.
SAD is not done.
No, it is not done. Maybe it's also ignorance. A lot of ignorance.
Maybe. I mean, if I have a really bad thought, it might be more comfortable if everyone lies there. Very bad sentence. I take that back now. Fascia bonding. Well, with the previous model, I managed to get my back down and touch my feet again when standing. But that was also, I could get down to my knees at first, then eventually further down. But these vibrations loosen the adhesions, don't they?
Exactly.
So I can train with the device to become softer again.
More mobile, exactly. You become more mobile, more flexible. And again, it depends on what he wants. You want to get your hands on the floor, you wanted to down with your feet. That's what you practiced with this movement. Others may want to improve their lateral posture. Others simply want the legs flexible. There are so many things you can do with it.
My goal is simply to put my socks on while standing.
So if you can do it on the Siwave, you can do it anywhere.
That's embarrassing, isn't it?
Yes.
Really putting on socks standing up, that's a long way off.
But you see, I don't want to repeat the age thing now. We've forgotten it too. But it gets worse with age. It gets worse with age, and that's always our intention, that we say, you have to move your hips, you have to stretch your hips. If you don't put your socks on afterwards, then you won't be able to put your shoes on either. You become so immobile. Of course, you can train all of this with the Siwave sine wave.
So 5 to 10 minutes on it every day. And then I've actually trained all the muscles, trained all the nerve pathways, set stimuli. I produce whatever hormones I need through the exercise sessions.
Slag substances are broken down. That prevents inflammation in the tissue, in the muscle area, in the tendons. It doesn't happen in the first place because you also break down the slag substances. It's all this metabolism, as we said.
I have always wished that something like this would include some practice, a training manual. I've never seen that before, but now you're bringing it with you. You've created it from your years of experience. This means that everyone can see what kind of physical problem they have and how they should train.
That's right.
So here's abdominal and back training, trunk lateral tilt, pelvic tilts, squats on both sides, and then instructions with photos on how to do it.
Exactly.
These are mega.
Points again as instructions. What kind of problem do I have? Is it an orthopedic one? Then it has a different color than neurology. So everyone recognizes themselves, and everyone can then say, I can do this exercise in neurology, I can do this exercise in orthopedics, for example.
I can't show everything now, but maybe the camera can capture it. Here's this beautiful picture, the elderly lady standing on it,
90 years old.
with weight in the front. So that's typical back training, that she learns to stand upright, right?
Yes, exactly.
It's also an age-related problem, that people are leaning forward more and more, isn't it?
That's right.
And here, I'm training the spine at the back.
That's right. And it has to be said that this patient also has metal in her spine, for example, which is actually contraindicated. But I also have to say that the therapist, the doctor who works with this Siwave, can make completely different adjustments. But the normal consumer should, of course, ask questions first.
Yes.
That's with the contraindications. But there it is, for example. The lady was already advanced again. Yes, there was a weight in my hand again.
Yes.
That was a supporting tool.
I'm going to flip through another one. Suddenly there's scoliosis, misaligned feet, herniated discs, arthrosis. With the setting, how much hertz you should set, how long, and how many repetitions a day.
Right. Exactly.
That's mega. Mega good. It says fibromyalgia, osteoporosis. Oh, tell me about it. Osteoporosis, improvement of bone strength and bone mass. Recommendation 15 to 24 cardio, 3 minutes, repetitions 3 to 5 times. So 15 minutes a day, with what kind of results?
Yes, there are actually good studies on this that you can read up on. And it's like this sine wave goes into the body and now not only reaches muscles and blood vessels, but also the bones.
Yes.
And in osteoporosis, these bone balls are unable to grow. This results in brittle bones. And you always want osteoporosis patients to exercise. And that's exactly what they do. And thanks to this sinus wave, they achieve excellent results when it comes to osteoporosis. And if they are then supported by medication, perfect. Whether you can ever get the whole clinical picture under control is another story. But we have patients who just want to vacuum, lift a table, and break their lumbar spine. And you have to avoid that.
Yes, I know. That's exactly what I value so much. And for my health, I do so many programs where I set a good example, whether it's about nutrition or exercise. Stretching is something that is still on my list. Stretching exercises. But with these fascia adhesions that get improved, I wouldn't have to stretch so much, would I? Ah, stretching. That hurts terribly.
Stretching.
Yes, stretching. Can you do that with this?
Well, if you want to stretch a muscle, then you have to stretch it in this movement.
Does it hurt less after?
Under certain circumstances, of course, if you have an adhesion, and this adhesion, as I just said, the fascia is like muscle skin. And if this muscle skin is stuck to the muscle, the movement doesn't work. It doesn't work. If we loosen these adhesions in the fascia, you can of course stretch a muscle much better, because the gliding ability of the muscle is of course completely different than if something is stuck there. But if you really want to stretch, you can stretch on the Siwave, as you just said yourself. I come down all the way. It's nothing more than stretching. And with vibration, the vibrations and oscillations that the Siwave emits help you to process the smallest structures such as capsules, ligaments, tendons, and muscles in a positive way, so that you can reach your feet with your hands afterwards.
So where I want to get softer, I put the muscles on the vibration plate. And then I let that and stretch more and more. And it gets more and more.
You can't avoid it completely.
No. Here you have squats on both sides of the torso. Bend, a leg stand. I thought that was mine. I also found it very important to stand on one leg. Balance here. And these are exactly things that we simply lose with age if we don't do them.
Like you, Silvia, it's also the balance problem. I'm sure you've also tried with one leg. It's natural at the beginning, you feel your way around, two legs, and then you sometimes like to hold on. But of course, if you're doing it properly, you should also do it without holding on, because your hand is healthy. The one leg needs to be trained if I have balance. And of course, when someone stands on it, as we experience every day, older people, it suddenly vibrates. They claw everywhere, they're afraid. And then you have to stand, you only need just have a little contact on your back. And suddenly they're standing on one of these oscillation devices, and you suddenly let go, they suddenly gain confidence. Yes, if you can stand on it, with these vibrations, at 15-18 hertz, you'll walk great on flat ground.
Yes,
A completely different level of safety.
I think that's also available with support programs.
Exactly, with a gangway like this.
You probably have that with you.
Yes, exactly. Simply as a gangway so that you can hold on a bit. There are also paddings where you can actually work your back more intensively. The idea is that these paddings give you a corresponding height with the Siwave. And then, of course, you have completely different options. Then you have contractures in the knee, for example, which you can release. Ligaments are shortened due to an operation. The capsule, for example, is something you can manage excellently if you still have such padding and more intensive again about these structures again. Yes, versatile.
I know that physiotherapy is something that the doctor very quickly writes a prescription for. It's off to the physiotherapist, who does it, and then at some point you're done with your set of 12, and the success is still not there. Sorry, that has been my experience, have been so far, and have also been reflected upon. But this is actually a physiotherapist 2.0. A physiotherapist who works with something like this really approaches the person as a whole, and not just one or two or three muscles that should somehow be straight.
That's right, exactly. That's how we see it too. We work holistically anyway. If we have a patient who has back pain, we straighten them from the feet, straighten them from the pelvis. The entire spine is straightened physiologically, and when we are ready, we train them. And with the Siwave, this oscillation reaches everywhere. That's the best thing you can do.
Absolutely. A healthy person like me can easily buy something like this and work with it. But if someone has a health problem and indication, would you recommend that you start with a physiotherapist first, who can then show you how to work with it properly?
In any case, that's how it works for us.
The book alone is not enough. You really should have the instructions first. Or the female instructions.
But one thing has to be said, we are no substitute for a doctor. We don't. So of course going to the doctor is the first thing. We need a proper diagnosis. And once we have a diagnosis, a clinical picture, then we can also try to help the patient with our physiotherapy and with the help of the Siwave. Or to accompany them to optimize their clinical picture, to optimize the pain.
You've already said that correctly. On the other hand, I think we have a lot more spectators. They are healthy and also realize from the show that you have to do something before something happens.
That's how it is.
And then it's always to the doctor, and then at some point to the physiotherapist. But the healthy people, that's cool.
Yes, of course. That's all people need.
We normally set the Siwave for 3 minutes. 3 minutes of intensive training, a short break, doing something different. I'll say cycling, jumping on the trampoline, then 3 minutes again. You do this 3 times. Then you've had a really good physical workout. You don't need any more. And as I said, you can't stand on it now. We can sit on it. We can put our hands on it. We also like to do that with shoulder patients. That was mobilizing the shoulders, that we improve contractures, whether these are tendon or muscle, with these exercises in the shoulder, i.e. to improve mobility.
You are now the therapists and the users. I now have a few questions that you may not be able to answer because you are not involved in sales. But as a viewer, I would say that I would like to try it out. Do I always have to buy it directly? Or can you say, I'll go somewhere and test it there? Or can I rent it? Do you know anything about it?
So you might know that better, Silvia.
I think you can rent it, but you can also test it at physios. None of that is a problem. You can try it out, and you can also rent it for a month or 2 weeks, depending on how you want it.
So really, anyone can test it out for 2 weeks or a month and then can decide.
Exactly.
You can tell, can't you? After this short time.
I have to say, I noticed it after the first time. I knew I wanted this device. I wanted to buy it, and that's what I did. And I still say today that it belongs in every household. Just as a television is in every household, a Siwave belongs in every household.
Yes, we always get more sluggish.
That's my opinion, yes.
There's another phase coming where we're not allowed out and
Exactly.
If I can interject briefly, because she says household, that's one thing. You're absolutely right. But the other thing is the business, the company, the work. We also have C-waves in companies that simply say, okay, before now the employees just sit there and do their rinkin and polish the diamond. They all have muscular back problems, knee problems, hip problems. And when they are allowed to stand on this C-wave for 3 minutes and come back in afterwards, you feel different too. You have to try it out. It really is like that. You feel different. You have a different energy. You approach your work in a completely different way. The best thing was once at a trade fair we went to. The showman came to us and stood on them because they had been standing all day. Tired legs, heavy legs, painful legs. They stood on them for 3 minutes and said, well, now we'll stay 2 hours longer. So it really is like that, even in the workplace. I don't know what it's like here in Switzerland, but in Germany we have a few paragraphs of prevention. And every boss says healthy employees, yes please, nothing better. And for 3 minutes, whether I smoke a cigarette, which is more harmful than our C-wave, I can add that in.
When I put the coffee machine down, everyone, 3 minutes. That's stupid now. I actually wanted to take it home. Now you've told me to leave it in the store. That means every employee should say 3 minutes every day. I've already read something about 8 minutes. So 3 to 8 minutes is allowed for each employee to stand on.
In any case, yes.
Of course, you also have to take a company schedule into account. And trained people who are now training on the C-Wave can easily spend 8 to 10 minutes on it, or 12. But if we have an older patient who doesn't know it at all, you can't put them on it for 8 minutes.
They'll probably be exhausted after a short time.
That's possible. The hertz rate is also reduced. And then we have the amplitude of this C-Wave, where it says max, where we have the highest amplitude at the front, where it says max. If the customer, patient, or user says, that's too strong for me, they can take half a step back before adjusting the hertz rate. That would then also be possible. But of course, you also have to say that 3 minutes is a good amount of time, and that's something that every company, every establishment has. Nobody can tell me that you don't have 3 minutes.
No, everyone really does. Really everyone. Too bad. I thought I could make my wife happy. Is this booklet always included when you deal with this topic? Do you know anything about it? Did you get it too?
We will always give it out. It's always a part of it.
It's really mega. I can see how the feet stand. It's just so instructive. I've always wanted that. I didn't have anything with the previous model. I don't even know what I can do at home. But it's already 10 years old, and that's a whole new story. Thank you very much for these reports. It's fascinating. I wish so much for the prevention of people at home that they also deal with it. Especially that you should definitely include exercise in your life. When I'm in strength training, I have to say I do all one-sided training. And here, I really have all the muscles.
All of it.
I'm not going to lose weight with it, but that's not the goal.
If I may then also hook in again, it is a sine wave that is generated here. That means we have an amplitude at the front, 2 moving plates. And there are so many devices on the market that promise something that they can't actually deliver. You have to be honest. You need those 7 millimeters, so 3.5 up, 3.5 down. Do you need that to build up muscle strength at all? You do. That's what develops the sine wave. That's what you need. Devices that really only vibrate. Wonderful. You get nice warm feet. You still have good blood circulation in your calves. But unfortunately, you can't talk about muscle building. You have to be honest about that.
And they can also be dangerous, I once heard.
They can also do harm. You're standing on the right axis here. I don't have to stand with my feet wide apart. That's not a good axis. Who stands wide and pushes away in the wide leg press? Nobody does that. Who rides a bike like that? No one. You have to stand on your feet, and then you can train your muscles optimally. And you stand on your feet. And if you're not standing correctly, you're not training your entire body well. You have to stand correctly, stand well, and that's what you do on the Siwave.
Dear Roswitha, do you have a final quote that you would like to say?
I now also work with older people and see how happy they are afterwards. It's like that when you realize that it's like a little bit of a new attitude to life when they train with you. They say thank you, and that's always nice to have in front of us.
Nice job then, right?
Yes, it's a great job.
Dear Silvia, have we forgotten anything else?
No, I've already said that. In my opinion, it belongs in every household. Just like a television is in every household, it belongs in every household.
If the viewer wants more information, we just said the name. There must be a homepage for it, right? And it certainly has everything on it. Medical indications and studies. There are already many studies that confirm this.
If there are really questions, including medical questions, clinical pictures, etc., the entire Siwave team is certainly there for you.
You can also contact your practice.
You can also contact us. Most people do this by email or via the website. And then we are happy to provide advice, of course.
And if you have a medical problem where you think, okay, I think I've heard something that might apply to me, can I come to you? You walk the path with them for a month, 2, 3. And then they see what has happened.
We first discuss what the clinical picture is, what he wants to achieve, what his goals are, what goals does he still have. There are illnesses where you have to cut back a little on your goal, and you have to discuss this and then see if it fits. And then you can certainly achieve a lot with the Siwave and physiotherapy.
I always remember a law of nature. Everything we don't need, nature breaks down. And that's why it's important that we strengthen all our muscles and nerves. Everything from head to the toe, to the brain are in constant use. Then nothing is broken down. And that's where I see great prevention and prophylaxis for the future.
That's right.
Thank you, dear Silvia, dear Roswitha, dear Helmut.
Alexander, thank you too.
It was a great honor, a great pleasure. I can do many more programs with you. You are mega competent.
Thank you very much.
Thank you for explaining that. And dear viewers, and also the many physiotherapists, doctors and therapists, alternative practitioners, and I hope we have been able to get the ball rolling here and provide some inspiration, which could perhaps also be a useful addition to your practice. And for the many people at home who have seen that they also have a lack of exercise, too little movement, too little use of their muscles, just like me, I'm getting stiffer and stiffer. I would like to take this opportunity to point out that you can really deal with this issue. With this in mind, all the best. See you another time, and goodbye to each other. Thank you for watching the Swiss Health Television program QS24. Please also go to Wikisana here. All programs compiled for you, free of advertising. And here below we have the button to YouTube, our channel. Please subscribe to that too. And here is a selection of interesting programs for you. All the best. See you another time. Goodbye to each other.